And I think the hardest is when they come in when they're asymptomatic and you're sending off routine labs and it comes back and you've got struvite crystals in there and you're like, oh gosh, now what do I do? And so I think that's when your history and questioning the owner comes in.
VetFolio Voice family, welcome back. Dr. Cassie here. This episode is sponsored by Hills and features Dr. Caitlin Getty here to talk about urinary issues. And I don't know about you, but I find urinary cases to be some of the most humbling to manage. I mean, sure, sometimes we get a straightforward ascending UTI, we treat, we keep in mind our ISCAID guidelines, and that's that. Maybe it was a one-off. But what about all the other cases? The asymptomatic dog who has crystals on the urinalysis, the conversation with pet parents about medical versus surgical management of bladder stones. And what about cats? Cats who bring this whole other layer of complexity with stress-induced urinary issues. Dr. Getty was a lot of fun to talk to. We covered a lot of ground in this conversation, particularly around how to interpret diagnostic findings and incorporate them successfully into our management plans. And of course, we talked about the nutritional considerations in managing these cases. We talked about pH and mineral content and components like tryptophan and casein, which can help with stress management. So if you have encountered your share of challenging, of humbling urinary management cases, this one's for you. Let me introduce Dr. Getty and we'll get into it. Dr. Caitlin Getty is a board-certified veterinary nutritionist with special interests in critical care nutrition, everything cats, and teaching. She spent 13 years at the University of Illinois, completing her bachelor's, DVM, and PhD in nutritional sciences. During veterinary school and her PhD, she became very interested in nutrition education for veterinary students and the power of nutrition in health and disease. She then completed a rotating small animal medicine and surgery internship at Premier Veterinary Group on the north side of Chicago and traveled to Raleigh, North Carolina to complete her small animal clinical nutrition residency at North Carolina State University. There, she developed a love of critical care nutrition and was fortunate to be involved in the education of third and fourth year veterinary students. She then started her career in the fresh pet food space and is now very excited to call Hills her home. In Caitlin's free time, she enjoys patio gardening, cooking, and country line dancing. Sounds like fun. Let's go ahead and get into our episode.
Microbiome science is a swiftly evolving field that has caught the attention of pet owners. Are you prepared to answer their questions? NAVC's brand new veterinary microbiome certification course will give you the skills to implement microbiome science in your daily practice and improve patient care. New research shows maintaining a balanced gut microbiome is vital for optimal nutrition, disease prevention, and longevity in pets. Register today on VetFolio.com.
Well, Dr. Caitlin Getty, thank you so much for joining me for this episode. We're going to talk about lower urinary tract disease, including things like crystals and stones. I'm so glad we're having this conversation because UTIs are one of my least favorite things to treat. And, just urinary issues in general, it's like the more I know, the more I don't know. And they quickly become something that I think is really challenging to treat.
Agreed. And the list of things that it could be just gets longer the more you know, right? And the more that you're looking for, it's crazy. Or it's just, FIC.
Right.
I say just with the ear quotes and the hand waves.
Yeah. It rarely seems like simple and straightforward.
No, and crazy enough, like the stones with the UTIs might be the most straightforward.
Right. Yeah.
And it's super complicated.
I know. And that's not easy. Yes. Okay. So same page. We're starting off on the right foot here. I love it.
1,000,000%.
So, with that in mind, we have an animal that comes in, lower urinary tract signs, and we send off a urinalysis to the lab because we, of course, want to know what's going on. Or maybe on the contrary, this animal is asymptomatic and we get this urinalysis back. One of the things that I have struggled with in interpreting a urinalysis result is seeing crystals there. Mm-hmm. I feel like it can be really hard to know when that's significant and how to approach it. And it seems very patient dependent. So I would love your take on that.
Yeah, and I totally agree. I think it's really challenging and really confusing. And I think the biggest nutritionist mantra with anything is like, it depends, right? And so the very patient specific thing is totally, totally a thing. And I think the hardest is when they come in when they're asymptomatic and you're sending off routine labs and it comes back and you've got, like 2+ or whatever struvite crystals in there and you're like, oh gosh, now what do I do? And so I think that's when your history and questioning the owner comes in really handy, right? Like, what are you feeding? Are you feeding something super high protein that maybe is contributing to a higher pH that's going to be supporting the struvite crystal formation? Or did we collect this first thing in the morning and it's super concentrated? That's also going to do we have storage issues? So I think with the asymptomatic ones, is it repeatable? First thing, right? And then if it is, what can we track down that might be causing it before we jump to stones? Like, is there a they need to drink more water cause? Is there maybe we need to switch up the diet? Maybe not a urinary diet, but maybe we need to drop the protein or something like that. The symptomatic ones, maybe a little easier, but not, right?
A little more straightforward where you say, okay, well, there are symptoms and I have
Yeah.
a potential cause here. Let me go down this route and see what I can figure out.
Yeah, because I think it depends on like, what are the signs? What breed is the animal, or like what species is the animal, right? Because like if it's a dog that's symptomatic, then I'm going to be looking more towards things like stones, UTI, something like that, versus a cat that's symptomatic, then I'm going to start thinking more like, FIC kind of irritation. Obviously, other things are on the table, but, a dog, what breed is it? Is it predisposed to calcium oxalate? And so if I see that in the UA, I'm like, well, maybe now we need to do a little bit more looking and really maybe actually consider a urinary diet. Is it like an intact miniature pincher? And now I'm thinking like, is there cysteine crystals in the urine? Like, and see so I think it's very patient specific, like you're saying, right? And so it just depends what kind of history you get, what's going on with the patient, who the patient is, and then you kind of go down that little path and figure out what's going on.
Yes. Yeah. Universal answer to medicine is it, it depends. And,
Yes.
and that can be a really hard thing to relay to pet owners and say, I'm not really sure what to do with this and how far to dive in because, as far as the crystals themselves go, those can form just in transit to the lab.
Absolutely.
Correct?
Yeah. Right. So like storage handling, if it's too cold, if it's mostly too cold, right? So that's when things start to precipitate out. And so that might be nothing, which is why I always say get a repeat or maybe collect it all throughout the day or view it in-house, right? Like view it fresh sample and see if you're seeing anything on your wet preparation.
Yes, I drag my heels on that, but I have been known. I'm like, crystals, I feel confident enough that I can pick them out in-house.
When you're like, they're pretty, like we can go looking for pretty things. Like that's kind of fun. And I think a lot of clinics have some AI technology and some equipment to help with that too. Obviously, eyeballs are the best, but we have things to help us right now. So
this is true. Yes. Leaning into the technology. And yes, that makes me drag my heels a little bit less on interpreting these in-house.
Right. Because just a little bit of help, just a little bit of help is always good.
Reassurance there.
Yes. Yeah. But always confirming, always asking a million questions and then going from there, but not freaking out initially. I don't think anyone does, but I think some owners do. So, chilling out a little bit and then going from there.
Yeah, digging into your history and what kind of patient are you dealing with and then deciding where to go next. When we think of, say, struvites or something like that, calcium oxalate, I remember being taught in school that these were very pH dependent in the urine. So if we do have an animal who we think is forming, these are truly, pathologic for lack of a better word, crystals that are there. It's not just an artifact. What should we know about pH when we're taking that diet history and making recommendations for adjusting the food?
And that's a really, really awesome question because pH is definitely one of those things that we get taught pretty strongly in school. And we're taught a lot about nutrition and pH and things like that. And so I think for struvites, pH, if you're feeding a pretty high protein diet and you're getting protein in the urine, a lot of times you're going to see, which doesn't necessarily make sense physiology, but you're going to see a higher urine pH, which is going to support that formation of the struvite stone. So maybe if we can get the protein content down a little bit to drop that pH, that can be beneficial. Or if we have, a UTI contributing to a high pH in struvite, And with struvite specifically and struvite stones, historically, well, trying to prevent them and trying to dissolve your urine stones, struvite stones, we like to have a lower urine pH, right? Because it's supported in a high urine pH. If we can drop the urine pH down, then that helps dissolve them. And so that was the technology of things like SD, which is no longer on the market. But now we have newer technology in foods like CD, where we can have more of a neutral urine pH. It's still kind of on the acidic side, but the other, mineral content and things in the food can really help support that struvite dissolution and prevention as well. And then alternatively, calcium oxalate likes acidic urine. And so we try to feed foods that are going to alkalinize urine to try to get those calcium oxalate stones that can't dissolve them, but to try to prevent them. But again, with the new technology, we can kind of have that metastable, little bit closer to neutral urine pH and still be able to prevent them through other means such as the mineral manipulation. But if we're going, straight by the book, nutrients of concern, then we want to try to avoid super acidic for calcium oxalate and super alkaline for struvite. But those therapeutic ones are now kind of sitting right in the middle. And it's really nice because it avoids other metabolic issues because of that extreme urine pH. We don't have the specialized kind of metastable urinary diets for that. We still need to target a really high pH or a much lower pH, such as like cysteine and urate and things like that.
Okay, so if I'm understanding, because I remember SD and, feeding that in certain cases, and it worked, but it was kind of this balance because you're like, well, we can't stay on this forever.
Right.
And so how do we balance this? And I remember learning, that CD could kind of work in both cases with our common types of crystals and stones, the struvites and the calcium oxalate. Although I'm glad you said that about calcium oxalate not being able to dissolve them, because when you said that, I got real excited for a minute. I was like, wait, we can make those go away? No, we can't, unfortunately. No. So more so, it sounds like with the newer technology, so to speak, we're aiming for more of a neutral pH and manipulating other components of the diet. But if we're talking about the less common stones like the urates and the cysteine, then we are still more heavily focused on pH.
Yeah, we're going to be more heavily focused on pH and other ways of manipulating whatever metabolic pathway is contributing to that type of stone. So there's other medications out there, or like I mentioned, the intact miniature pincher earlier, right? Like neutering the pet to see if that can change the metabolic pathway. But like the CD with the pH is more neutral, but also just to kind of round out the nutritional profile, right? It's got more of a moderate protein level because we don't want to add too much protein to, support. We don't want to make, too much struvite, right? We don't want the ammonium, right, coming from the protein. We want a moderate to lower magnesium, again, components of the struvite, lower calcium, things like that. It's not a high salt diet because we don't want to promote any urinary excretion of calcium. And so it's really targeting all of those different nutrients of concern while keeping kind of a more neutral pH and not trying to drive water intake necessarily via sodium, but still supporting adequate hydration and trying to keep those crystals and stones from forming within the urine.
It's so cool. I love having these conversations because it's so neat to see the progression of all we've learned about ways that different nutrients can affect the gut and therefore the rest of the body. And it seems like that research and that information is just going to continue to progress and evolve. And I mean, just looking at from the time I graduated to now and the difference in what we have available to help manage these urinary conditions is so cool.
It's awesome. The technology has really come a very long way.
You're just learning so much.
Yes.
So what about, let's switch gears to cats for a minute, because, they, like you said, they throw in this extra variable of like, are we dealing with fluted or FIC, where it's more of a sterile process and an inflammatory process. I know certainly I'm talking to pet owners in those moments about a diet like CD, but I do kind of get the question of like, well, what is it doing? And I know a little bit, but you probably have a much better answer than whatever it is I say as far as how this food is helping these cats with FIC.
I am sure that you are giving your owners a fantastic answer.
These cats are doing great. The vote of confidence. I'm not gonna go into my answer here for fear of what it might sound like.
I'm sure it's awesome. But CD is cool because so we've got base CD, we have CD stress, and then we have another combination diet, CD metabolic stress. But even base CD, has all of those mineral and protein manipulations to help reduce any kind of crystals that could be causing irritation, right? Which is different from FIC, but We want to then avoid any kind of potential additional irritation in there. But then we also have some, essential fatty acids in there that are really going to help reduce inflammation and irritation within the bladder. And so if we can keep that irritation down, we can keep some of that spasming down, we can keep some of that hematuria and maybe urge to urinate, super frequently, that plaquuria, try to keep it from causing issues in the cat. And then if we go to diets like the CD stress, then we have added components like the L-tryptophan and the casein, which are really going to help manage the stress in those cats. And we even have data that those cats become, more interested in hanging out with their owners. They seem visibly less stressed. And then, with the base product of CD and then built into the CD stress, we see decreased incidences of FIC in these cats over time, which is amazing because, it's not a disease that we can eradicate. It's a disease that we have to manage. But, being able to reduce it by so much is so helpful and so beneficial for those cats. And really, the owners are really stressed out about their cats too. Like, they're worried about the cats. They're worried about what the cats might be doing to the house. And so being able to provide a diet with the really cool nutrition built in, and then even the stress components built in to help these cats feel the best that they can, it's really helping the cats and the owners. And by reducing those incidences, everybody can be much happier together.
Good news. My answer was mostly on the right track there. So I'm glad to hear that, particularly the tryptophan and stuff like that. And I have to say, anecdotally, I've had a lot of success feeding, particularly the CD stress in these FIC cats, because it can be such a difficult condition to really get a hold of. I tell the story of a cat where, we were trying everything to try to figure out his anxiety. And after, I don't even know how long, it was the chair was on the wrong side of the living room. The owner had moved the chair. I want to say 2 or 3 months before this. And when she moved the chair back, then everything got much better. But something like that, it's so hard to pin down what the stressor is.
Cats are very delicate creatures and they don't like it when things change. We work with a behaviorist often with conference talks and things like that. And he tells a story about, a cat that's upstairs and couldn't get downstairs to its litter box because there was dogs. And they're like, okay, well, you just got to put a litter box upstairs and then, the stress and things will go away. And so I think the multimodal management part of it too, in addition to the food, is super, super important, right? Making sure that they can get to the litter boxes, making sure they have enough water, making sure they have access to the food that we're trying to feed them, right? So it all kind of goes together, and it's super important to hit all of the points, I think.
Oh, yeah. And that's a podcast episode right there of do they like running water? Do they like still water? Making sure the bowl is really full so we don't hit their whiskers, or they have a really wide bowl, or
yes. Or my cat that drinks it off her paw.
There you go. Yeah. And they if it's still, then they're going to move it and they're going to splash it everywhere.
Yes.
Oh, they're funny creatures. I love them. Yes. But you brought up a really important point about history taking, because especially with something like FIC, we really have to dig into the history to find out what that stressor is, what's driving these symptoms. And so one area where I know I try to be really careful about not getting hung up here, but it's easy to do it, is polyuria versus plaquuria, and really asking the right questions. So we're differentiating with pet owners to understand what types of symptoms we're looking at, because that's going to change our differential list quite a bit. I'm wondering if you can expand on what we mean by polyuria versus plaquuria, what those look like, and how that affects our differentials.
Sure. Yeah, because it's super tricky, right? There's all the different P words that come with urinary discussions. Yeah. But so polyuria, right, is going to be a lot of urine and generally more frequently throughout the day, but it's going to be larger volumes of urine, right? And then plaquuria is generally going to be smaller volumes of urine, but still frequently trying to urinate or making small volumes of urination. And so polyuria often is going to be paired with also more drinking, right? So you might hear the term, vets know this, but if we're talking to owners, they might hear the term PUPD, right? So polyuria, polydipsia. And which one is driving which is also going to kind of go into our differential list. But, I think things like diabetes and renal disease and whatever, things like that when I think polyuria. When I think of plaquuria and, if there's straining with it, if there's, any kind of change in the house, now I'm looking more do we have stones? Do we have maybe a passing obstruction? Do we have irritation in FIC? I think species also goes into that, right? If it's a dog and it's a male dog, maybe I'm thinking different things than if it's a cat who just moved. And I think we probably have an FIC going on. And so I think, the metabolic causes more when I'm thinking polyuria, and then the functional and like anatomic causes and maybe stress causes, right, leading to those functional causes when I hear plaquuria.
Yeah, no, that makes sense to say, we have something working more systemically, usually when
Mm-hmm.
we're getting up at the level of the kidneys and things like that. And generally we're dealing with something metabolic and a little more systemic versus, like you said, functional, anatomical, a little more localized with the
Mm-hmm.
plaquuria. We're seeing the small frequent urinations. And, we're talking about cats. You're mentioning, managing these cats, the owners end up really stressed out. They're worried about the cats because that's when we start to see our blocked cats
Yes.
and
Oh my
really
God.
get into trouble. So yeah, all the more reason to make sure we're understanding what we're looking at so that we can guide them appropriately and keep these cats safe. Because man, that's
Yeah.
scary to think, oh, I could come home and my cat is blocked and here we go.
Well, and three of my cats are boys, so I
Yeah.
feel that.
Yeah, I know my
So,
cat's a
yes.
male too, and I'm like, oh, please don't be a fluted cat.
Yeah. I mean, I guess it can happen in girls too, but like we think about it.
Yeah.
But that's also why feeding just to get the nutrition, like feeding something that can help with that inflammation can also really help with those kinds of episodes as well. It's not going to eliminate, we still have to be worried and concerned, but it really helps, reduce those kinds of stressors and reduce, our level of concern and feel more comfortable having our cats at home. So I think
Yeah,
that's really
yeah.
big for the cat and the owner.
Right. Yeah. If we're reducing these, flare ups, so to speak, of
Mm-hmm.
these episodes, then we're reducing that risk a little bit.
That's
And
scary.
it is. It is. I agree. How does our clinical approach differ when we're talking about urinary issues in a dog versus urinary issues in a cat? And we've touched on this a little bit in terms of the differentials will vary.
Mm-hmm.
But then when we start to think about treatment and long-term management in some cases, how are we going to approach those in the acute period and maybe in the long term as well?
No, that's a really good question. And I think, again, it goes back to the case dependent conversation a little bit, right? So I think on the cat side, if we've done our whole workup and we've decided that it is, FIC, the idiopathic cystitis, we're not sure exactly what's causing it, but we think stress, we're looking at lifelong, nutritional management. We've done the workup for maybe a UTI. We've done the workup for stones. We've screened for things like renal disease. We've screened for, I don't know, GI disease, anything that could be causing them to be uncomfortable, and we've landed on FIC. We're looking, long-term urinary diet type management to help keep that bladder and that gut, well, not gut brain, the bladder brain kind of axis happy. It is a metabolic thing. So like, let's say it's a cat that has maybe calcium oxalate stones or something, because that does happen in cats, or maybe sterile struvite. Now we're looking at, management with a urinary diet. Still probably long term, depending on what the cause of the issues are. But a lot of times I feel like in cats, once we've discovered a urinary issue, whether it be stones, whether it be crystals, whether it be, FIC, I feel like the management is often lifelong. Whereas in dogs, depending on what's going on, like if we have a UTI and struvite stones and we've worked up everything, now we're looking at, let's put the dog on CD. Let's start the dog on, an antibiotic after we've done our culture and sensitivity to make sure that it's the appropriate antibiotic. And then let's do those rechecks and keep the dog on the antibiotics until we're sure that the stone is gone and that we culture negative, right? But because if we stop the antibiotics and we still have a stone and we're still trying to dissolve the stone, now we're going to release more bacteria right into the urine, which then it comes back and then it's a whole thing and then the stone can reform. It's a whole thing. But those dogs, don't need to stay on a therapeutic urinary diet for their whole lives. They just need to be on that diet until we've resolved, the UTI and the stone issue. Other issues we can talk about when we get down, down the road that might be causing it. But then things like a urate former or a cysteine former or something like that in dogs. Now, again, we're looking at lifelong management because it's a metabolic disease as opposed to an acute short-term process. Or those little like Shih Tzus that have calcium oxalate crystals and stones, right? Like they're going to need to be on therapeutic urinary diet for the rest of their lives. But those UTIs with the stones, those are the ones that actually don't need to.
No, kid. Okay, so this is, I hope I'm not the only one that this is news to. Because I was kind of like, once we have stones, I tend to really like them to stay on a urinary diet, regardless of what stone, because I know they just can be really hard to manage. But what you're saying makes sense, that if the UTI is the cause of the struvite stone formation and we resolve the UTI and we dissolve the stone, assuming that we don't have another UTI, then there really wouldn't necessarily be a reason for them to stay on it unless this is one of our dogs that's getting recurrent UTIs.
Correct.
In which case, we need to look at if we can discover a cause, is there an anatomical cause or something we can do to prevent those? But yeah, to say this dog did form a stone in response to a UTI, but as long as we're not getting, repeat UTIs over and over, then we can have them go back to their regular food.
They can, as long as it's a simple UTI with simple struvite stones, right? You can resolve the issue and transition them back to their normal diet. But you mentioned a good thing, let's look at any kind of anatomical cause that can be leading to this. And so one of the big ones I think about is obesity, causing maybe a hooded vulva or something like that. Obviously more common in females just in general. But that's where maybe staying on a therapeutic urinary combination weight loss diet kind of thing, longer term would be beneficial to help, get the weight down to help reduce any kind of potential UTI cause. But then if this is a dog that's getting a lot of UTIs or something because it's overweight, this is probably gonna be a longer term management thing, and it's going to depend on how this goes, overall, but trying to get that weight down and manage that. And then maybe, they can transition to some other kind of weight management food, but, keeping an always a close eye. But it's those simple UTIs with struvites that can actually go back to their normal diet, just with, careful watching for any more UTIs.
Absolutely. Yeah. Is there such a thing as a simple UTI? My goodness. Those bacteria are so clever once they get into the bladder. You're in my brain here, because this is exactly where my brain was going next. You mentioned a combination urinary and weight loss type of food. And we're very thankful that the nutrition companies are out there knowing that we're dealing with multiple comorbidities in many of our patients and creating foods to help us address those comorbidities. So along those lines, can you talk about some of the combination diets that are available so that people kind of know what the options are when they are faced with one of these patients that has urinary symptoms but also has other comorbidities?
Absolutely. So I think I mentioned the CD stress up top. So that's, going to be for our cats with FIC primarily, right? So that's going to have all of the wonderful nutrition of CD plus the stress nutrition. And then we've got the CD combination with metabolic. And so metabolic is one of our weight loss and weight management diets. We have it for cats and dogs. I'm sure you've seen a lot of FIC cats are overweight. We just talked about how, dogs that are getting UTIs because of their anatomy are often overweight. And so really being able to manage their body weight, and that can help reduce FIC too, right, in cats. And so we've got the combination CD metabolic, and then in cats, CD metabolic stress, which is pretty cool, which I think is awesome.
Yeah, triple threat there, triple combination.
Yeah. And then released just recently, within the past year or so, we also have CD low fat in dogs, which is a really cool diet, I think, because it's really geared towards those little guys with the calcium oxalate stones that also have, lipid handling issues. And so another kind of case of animals that need to be on therapeutic nutrition lifelong. But, those dogs, in addition to having lipid handling issues that are actually kind of related to their calcium oxalate stones, but they tend to get things like pancreatitis or PLEs or things like that. And so being able to have a urinary diet that's also ultra low fat is super beneficial. The one thing that I think comes up often is, cool, it's low fat. Can I use it for weight loss? And it's not a weight loss diet. That's what the CD metabolic is for. The low fat, yes, it's great. It reduces, calorie density, things like that. But that food doesn't have, the enhanced fiber. It doesn't have the same kind of mineral considerations and amino acid considerations that a weight loss food, if we're going to restrict calories, might have. So it's really intended for those little guys with fat handling and dietary fat sensitivities. But it's also a super cool diet.
That is cool, because I can't imagine having to choose between, do I manage calcium oxalate stones or PLE or chronic pancreatitis? Right. Exactly. I don't want to make that choice.
And those dogs get those things,
they
right?
Do.
So it's really challenging. And CD it's not a high fat diet. It's a pretty moderate fat diet, but it's, for those chronic pancreatitis guys, I want it to, be even lower. So the CD fat's pretty awesome for that.
That's neat. I didn't know about that one. I'm glad that you brought that up. Yes, I was familiar with the urinary stress and the tryptophan. I forgot about the casein, so I'm glad we talked about that earlier in the conversation. But CD low fat, that really, I think we're identifying as we're learning about chronic enteropathies and things like that, these fat responsive enteropathies, whether it's chronic pancreatitis or PLE or something along these lines. And so, yeah, not having to choose between comorbidities it reduces my stress.
It's so much easier for the practitioner, right?
Yes.
To just have an option that, okay, this is what this is for. Let's give it a go. Like, let's see how this patient responds. It fits all the criteria. So
absolutely.
Yeah. It's so much easier. You used to have to go to a nutritionist for a homemade diet for that.
Right. Yeah. No, yeah, absolutely. And so, yeah, to have something that I can say, hey, or I can put this in your hands.
Exactly.
Is
Yes.
easier for everybody involved. Well, everything we've talked about thus far, really, really helpful in terms of most of the bladder stones that we'll see, but particularly struvites and calcium oxalates, since those are the stones and the crystals that we see most commonly. Mm-hmm. But I'm wondering if we can chat a little bit about some of our weirder crystals, our weirder stones, less common ones like cysteines and urates. What patients we're going to identify those in, how we're going to identify them, and then what the heck we're going to do about them.
I know. It's crazy because it's not just calcium oxalate and struvite. There's all kinds of different ones, and sometimes they compound together, which is then even more confusing.
I forgot about that. Yes, they do. Oh my
just
gosh.
Add another layer. We don't need to worry about that. We don't need to worry about that today.
Oh my goodness. Yeah, it's like one on the outside and then the core is a different one.
Yes.
Ah.
I know. So probably two of the more common weird or unusual stones, right? You mentioned the urates and the cysteines. And those ones tend to be more metabolic or genetic in cause. And so we don't see them as frequently, but we do see them with like certain breeds or disease conditions, right? So if we see like a cysteine stone, I'm like, is this an intact dog? Is it, intact male dog? Is it, specific breeds that might be predisposed to this that's leading to it? I am less thinking about, a primary nutritional cause. I'm thinking that the dog itself has some kind of metabolic issue that we can help manage nutritionally, but is not going to be a nutritionally driven concern. And then urates can be nutritionally driven depending on the urine conditions, or if we have something like a shunt that's leading to maybe a different metabolism, or we have a predisposed breed that is not handling things correctly, then, we might see urates in the urine, but usually, again, metabolic. And I would say we could go into this for like probably an hour just on weird stones and their metabolism. But I do want to put in a plug for the Minnesota Urolith Center. Probably most people are familiar with it, but their website is fantastic. I reference it most of the time when I'm looking up strange stones or like what the medical management outside of the nutritional management might be. Like what medication is going to help us adjust the pH? What management is going to help us, kind of overcome that metabolic pathway to be able to convert the stones or convert the precursors into the thing that's going to be, dissolvable in the urine. And so they have these really cool PDFs for like every kind of stone. And it's more than just the, 4 or 5 that we mentioned today. There's like 20 or 30 PDFs on their website of different kinds of stones for dogs and cats and how to manage them. But for like the really nitty gritty, what the metabolic pathway is, what the nutritional management is, what we need to be looking for, I like to send people there to look up the really cool, and it's all super simple to understand, right? But what is it? How do you deal with it? What kind of testing do we need to do? Genetic testing? Do we need to do androgen screening? Like what do we need to do to manage these stones? And I know that's not, specifically cysteine and urate, but that really has all of the what to do, and it's really all easy in one place. And so I like to be like, MUC is where it's at, to look up all this information, just to have it right in front of you.
Yeah, no, that is helpful because we never know quite what we're going to have in front of us. Like you said, it can be one type of stone or a combination or something that we maybe didn't expect in this dog. Mm-hmm. And now how are we going to manage this nutritionally or otherwise? Or we need to manage this type of crystal or this type of stone, but we're also balancing other comorbidities mm-hmm. and what sort of things we need to keep in mind. And I'm going to ask one more question and then I'm going to stop because otherwise I will sit here for an hour and be like, but explain the metabolic pathways to me because I just am curious that way. When I think of urates, I think of Dalmatians.
Yes. Yeah.
What breeds am I thinking of with cysteine?
Cysteine, things like miniature pinchers are going to be some of the big ones. I want to say that bulldogs were on the list as well. I'd have to honestly go back and double check what the different ones were, but that's always the one that stands out to me. And
is
again,
that miniature pincher
is the miniature pinchers. But I will say, and this is something that I think we were taught in school and that I've, taken to heart. There's only so much that you can have at the tip of your fingertips and memorize at any given time. And so that's why I plugged the MUC, because I think knowing where to find the information is super helpful. So like, even if you can't remember like the 5 breeds that are cysteine predisposed, you can look it up. You can look it up and find it out. Yeah.
That is a huge plug, because that is important to say, we're not going to be able to remember all of this information off of the top of our heads, none of us. So yes, having it readily available in easy to read PDFs is amazing. And I had a light bulb moment when you were talking about the lipid handling and changes in lipid handling playing a role in calcium oxalate crystals and stones. And I kind of went, oh, that's why we see it in the breeds that we see it in. Like, it makes sense now. And so that was a huge light bulb moment for me. So thank you. I feel like I have learned a ton in this conversation. I still feel like urinary issues are super complicated, but all the information we can get about them helps us manage these patients that are very individual. And I agree, follow the universal answer to medicine when it comes to diagnosing and managing them. It depends. Caitlin, thank you so much for joining me. Like I said, I've really loved the conversation. Any final thoughts you want to throw in?
No, just thank you so much for having me. And this was a lot of fun. And I guess I can put also a plug in for if you have questions about any of the Hills foods, or if you want to know more about, our urinary lines, right? We've got all of our CDs, but don't forget we have things like UD, right? To help manage those urates and things like that. Don't forget you can come to hillsvet.com, and we have our product guide and all of our different product pages, and you can learn more, and always talk to your Hills rep and ask any questions. And if they're, too crazy, they'll pass them along to us, and we'll do our best to get you an answer.
Yes. And I love that you said that, because that is one of my favorite things, is just when I'm sitting there kind of just not knowing which way to go with a case nutritionally, I'm like, wait a second, I can just pick up the phone and get an answer. I don't have to figure this out by myself. Yeah. So I love that you put that plug in. Thank you again. Like I said, great conversation. I really enjoyed it.
Thank you.
All right. I want to say a big thank you to Hills for making this episode possible. Caitlin, thank you so much for joining me. It was really a wonderful conversation, and I really appreciate all of your insight. And of course, a huge thank you to every listener out there who tuned in. We're always so happy to have you. If you did enjoy this episode and you would please leave us a 5-star review wherever you get your podcast, that would be absolutely wonderful. To help other veterinary professionals out there find this episode and other episodes, we really work hard to try to put great content out there for you. If you want to hear more episodes, you can click on the education tab on the VetFolio website, or find us wherever you get your podcasts. Of course, I want to hear your thoughts. What did you think of this episode? What do you want to hear in the future? So reach out to me at dvm@vetfolio.com. You can also find me on Facebook at Dr. Cassie DVM, or on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.